Welcome everyone to our Town Hall event looking at creating race equity for Black and minority ethnic staff in population health sciences. Thank you so much for coming, and thank you to our panellists for making the time to come as well. I'm Claire Herbert. I work in the Central Equality, Diversity and Inclusion team, and I'm really pleased to be here today to facilitate, so thank you to the Central team for that. This isn't just about academic staff development, this is about professional service development as well. It's about our clinicians, it's about our researchers. So it'd be great to really get a feeling for the different issues facing different groups within the faculty. Finally, next steps, the most important bit. The Central team have been really clear, and they wanted me to really emphasise that this is a starting point, it's not an end in itself. This is going to start forward thinking, forward conversations and forward actions. We are going to be sending around a full write-up of the event today to all of you, hopefully within about a week of the event. And then I'm sure we'll be in contact and hopefully you'll see things happening across the faculty. It's also going to feed into our Central team discussions as well. As a university, we're reapplying for the Race Equality Charter mark in July, and so this event and these conversations will hopefully feed into those discussions and those actions as well. So thank you very, very much for being here. I'm going to hand over now to Graham, who's going to kick off and give us some background for the event.
Thanks, Claire, and thank you for the time and effort that you've put into this, along with Kate and Isha and of course colleagues for coming today. It's really superb to see so many people here. I say so many. It's like having a party. I was sort of really nervous about people actually turning up. So it's wonderful to see that. So I've got a few slides just on some of the figures that we've been putting together. I think a challenge in this area is we have relatively poor information, and so it's inevitably a rather limited picture, and we would like much improved management information in this space, and I think UCL is committed to working towards that. But if we just look at these slides, you can see that in terms of UCL staff, around about 19% self-report as BME, but we have quite a large percentage, 12% of people who don't report their race ethnicity. However, for UCL as a whole, with under 20% of staff being BME, it doesn't represent our London population, in which over 43% of the London population self-reports as BME. So we're underrepresented, and apparently this is something that staff and students often comment on as they come into the university, that it's quite a different kind of environment to the immediately outside the gates in Camden and the area that we live in. So there's already a bit of a culture clash experience, quite separately from the figures. So yes, a proportion of UCL BME staff, less than half that of London. We don't quite understand why people are not wanting to self-report their race, ethnicity, and we need probably to do some more work on that to encourage that kind of disclosure, because whatever the personal reasons, for the organisation, getting better handle on those numbers would be hugely helpful in directing some of the discussions that we're going to be having today. So the faculty, 23% of staff in the faculty identify as being from a BME background, but as Claire's noted, this is a sort of complex issue. The complexity comes in the fact that there's variation in the grades and appointments of those BME staff. So nearly 29% of our BME staff are in professional services, administrators, managers. 22% are researchers, and only 16% are academic staff. So if you then look deeper into those figures, you see a stratification by race and ethnicity. So we've not been able to secure any information at present, although we're going to be doing much further work on this, around promotions across the piece in the faculty. But we have exceptionally good data on senior promotions, and so that's what I'll report. So 16%, as I've said, of BME staff are on academic contracts, but only 12% of senior promotions have been BME staff. So we already start to see a difference there in the numbers of BME staff who are academics, but those that are going through to promotion. 14% of professor promotions were BME staff, and this is the last 4 years, by the way, and 11% of readers. So we're not doing as well as we might be. One very reassuring note for me was that all BME staff who applied for senior promotion secured that in the last 4 years. So at the point at which BME staff are coming through and applying, then they're getting the promotion. So there's no bias, systematic bias in terms of the selection of those people for promotion. Now, whether that applies to other grades, we don't know. We need to look into that. And I think for a lot of professional services staff, we need to be assured that that's the same situation. I'd be surprised, frankly, if it was. I'm not that optimistic that we're in such a good place. So we're committed, as you've seen, to ensuring that there's equity for BME staff in the faculty, and this is just the beginning of that process. But again, I was sort of quite saddened to see some of the comments that we got from the race equality survey that was done recently. And some of these comments from staff really make one feel that there are actually structural barriers to people getting on and doing well. And this is something that we really need to address. There's the numbers. There's bad news and good news in those numbers. But the people are on a day-to-day basis experiencing essentially institutionalized racism, in a sense, is something that we really are determined to combat. And we were putting around the material asking you all to come, and there was one quote that I held back, but I want to use it now, from a BME woman writing in the Race and Equality Survey. And this is really pertinent for us today. I don't think it's fair for UCL managers to make tokenistic gestures in a public setting about getting BME staff into higher grade posts and encouraging staff to seek secondments, if the reality is that they don't support their own BME staff to actually move into higher grade roles and instead try to keep them where they are because the arrangement works for them. Now you can see why I might want to hold that back, because what we do not want this to be is a tokenistic gesture of senior staff standing in front of you making promises. We want to start a conversation that's going to lead to real action in terms of improvements and equity for BME staff. I'll leave it there and turn to Provost, who's very kindly come along today to speak to some of these issues and take questions. Michael.
Thanks. I'm just struggling with the microphone. I can't use that one. So thank you for asking me to come along to this. It's a pleasure to do so. And what I'm going to do is just update you about 4 or 5 things that are going on beyond your faculty across the whole institution. And just to give you a bit more background and to open things up. Shall I use this one? Is that better? So I've just outlined a few things on the next slide, which is, I think it was well known to individuals that, and I guess I want to make it clear that I didn't know about this in advance, that some of our rooms were booked by what seemed to be an external agency, turned out to be an honorary member of staff to conduct a conference that was essentially about white supremacy. And that was hugely embarrassing to the institution, you know, that's been dealt with through a review. It can't happen again. The bottom line is, if people don't tell the truth about what a conference is about in the paperwork that we collect together, it's very difficult to know precisely what's going on. And those conferences, I think there were 2 or possibly even 3 of them over a number of years, took place. And the last one was exposed by the press and was hugely embarrassing for UCL, and of course has led to a significant tightening up of procedures. But as part of that, the request from the students who were upset and by the staff who were upset was, would UCL please start to recognise and deal with its history as it relates to eugenics. And therefore we have set up a review, particularly of the input from Galton, Pearson and Petrie into this university's history and everything that has gone on over that time. We actually have a very significant collection of materials from that period. And of course there was also the Galton legacy, which is wrapped up in the background endowment finances of UCL. So we also had a request for help about the naming of lecture theatres, etc., from the head of the Department of Statistics, which is where Gordon was originally working. Rather than deal with that internally, we've decided that this needs to be a full-on detailed review of the entire history of UCL as it relates to eugenics. And I invited Professor Leola Shalanki from the University of Leeds, an academic lawyer, to conduct that review. And the whole idea really is to get everything out on the table and to make some decisions about how to portray our role in that history and where we see Galton and Pearson and Petrie in the modern era. That will include consideration of renaming of lecture theatres and buildings and so on. But I don't want you to think it's just about that. It's absolutely, it's absolutely a major process. We've had to put together funding for a couple of researchers for that to be conducted. So there's an investment of about £30,000 or so in making that review really high quality. So that's one thing that we are doing beyond your faculty. The next thing I want to just cover is some work that Marcia, who's on our panel here today, has been involved with Ijoma Uchegbu and Paulette Williams. And they have met with each and every one of our deans, Graham included, and agreed with them to make race-specific pledges in their activities. I should also add that all deans have objectives in their annual appraisals related to equality, diversity and inclusion, and their performance in that regard each year is reviewed by each of the linear vice provosts and is therefore included in consideration of their remuneration. So there's quite a significant request of our deans to take all of this seriously, and clearly Graham is, and I think that I can reasonably say that there's been a good response around the university from the deans to the input from Paulette and Marcia and Ijona. What else have we done? We now have a bank of internal fair recruitment specialists. These are individuals who've been trained so they're able to be part of any recruitment panel and provide expertise in the recruitment process. They have a full voting role in recruitment decisions, and the idea is that they will help to ensure that UCL recruitment panels are ethnically diverse and more transparent. And it's great to see that Graham has pledged for this to be a key strategy for your faculty. These are some race-specific development programs that have been put together, and we want to be clear that we're not taking a deficit approach to advancing race equality, so these programs have been chosen and developed carefully because they avoid such an approach. So, for example, feedback from Stella HE suggests that participants have really valued the chance to explore ethnic identity in the workplace and to develop an authentic identity in what is primarily a white culture at the moment. And then finally, I think this has already been mentioned, UCL currently holds a bronze race equality charter award. If I just broaden that out for the moment, I think it is important for you to know that we are the only institution in the country that has an Athena Swan Silver Institution Award, Race Equality Bronze, and we are also part of the Stonewall 100. So I think our overall track record is improving, and we're going in the right direction. I think we've got a sector leadership position, but I'd be the first to say that I think that's only absolutely a start, and there's still a long way to go. So we're certainly not complacent, but we are working to submit a renewal for the award in July. We know, I think, that will be quite difficult, but it's our opportunity to bring together all the work that's taking place, learn from it, and build on it, and that includes the work we're doing for students as well. And we want to ensure that events like this event today feed into that thinking and help us focus our renewed priorities. And we need to ensure that there's support and accountability for race equality across the whole of UCL. And I'm committed, obviously, to supporting Graham and your faculty, all faculties, of course, in advancing this discussion and bringing about real change. So when we get to Q&A, which is coming up shortly, please feel free to ask anything that you want to ask, no matter how difficult it is for any of us at the front or for any of you in the audience. I think the only way we can make progress is to get a really honest dialogue going, and I'm very much in Graham's camp. We can talk about this a lot. The key thing is, what do we do differently? And we've got some really good examples of things that have made a huge difference in the promotions process, in the recruitment of heads of departments, where particularly for gender, we've shown that we can make a real difference. And I think we're a long way behind where we are with gender with regard to race, but at least we've got it out on the table, and at least we're starting to do some tough and difficult stuff about it. So thank you, and I look forward to participating in the rest of the morning and the discussion. Thanks.
Thank you, thank you. We will get on to Q&A, I promise. We've just got two other things. Talking about the Race Equality Charter, as part of that reapplication, you may have responded to it. We ran a survey at the end of last year looking specifically at race equality at UCL. And from that, we've taken some of the quotes, and some of our very talented staff have kindly read them out for us. And so we're going to play that audio clip, and then we're going to finally get to the rest of our panel, who are going to get a chance to introduce themselves, and then I promise you'll get to answer some questions as well. So if I just start with this.
Within academia, racism does not manifest so much in incidents as it does in subtle, covert bias, where you are considered less skilled, less intellectual, less trustworthy, less of a potential leader, or less some other X factor if you are non-white.
The issue is often in the microaggressions. Who gets selected for meetings or task groups or overseas conferences? Who gets meaningful opportunities for development and how they are supported by their line manager? It's about fair succession planning. It's understanding that success and excellence can look different. It's how senior leaders champion and identify potential in those below.
I still go to meetings to this day where people who haven't met me before assume that I'm there to minute the meeting or I'm an administrator. Not that there's anything wrong with that job, but I believe that these assumptions are based on my appearance.
I will never be able to prove any discrimination based on race. That is one of the extremely challenging things about being BME. Every slight can be reduced to a petty complaint, and being BME, you have a stereotype of having a chip on your shoulder. So what can you do but be silent and bear the wrongs? It is everything that you have ever read. Death by 1,000 paper cuts.
Colleagues have approached me in a way that exposes the stereotypes they might hold about black people, such as the use of slang. Expectation that I will know other black people or celebrities. Expectation that I will be familiar with certain aspects of what's perceived as a black culture.
UCL has a serious problem with recruiting BME staff to academic posts, and those that are usually on temporary contracts. They're clearly good enough for the role, so I'm baffled as to why they're not offered permanent contracts.
There are microaggressions that in the end wear you down and you think, why should I bother? It doesn't matter if you work hard. The recognition is missing. If you give feedback or suggest improvements, you're either ignored or you're just seen as complaining. But from non-BME staff, such behaviour would be applauded, seen as ideas, creativeness, leadership material.
In the department in which I work, black and minority staff are strongly overrepresented in the lowest paid jobs, with none represented in the upper levels of administration.
I wouldn't feel comfortable reporting a race-related incident because I would be labeled too sensitive or unable to take a joke. I also wouldn't want to cause trouble for the person.
I think there's a very specific look to who's promoted and who isn't, just as there's a specific look to all the directors at UCL. Maybe this is why we don't show the photos on the leadership page. There is literally not one who is racially diverse. Not one. This is a reflection of UCL at its core, and in my opinion, it can't be a global university without any racial diversity in its leadership.
So I'm Nish Chaturvedi. I'm a clinician, an academic, a professor. I'm a director in an MRC unit, and I chair a research funding committee. So with that summary, I am pretty similar to white male colleagues. However, having off-home Paki shouted at me is something I don't share with my white male colleagues. I can't judge how much a lifetime of both overt and covert racism has impacted on the opportunities that have been offered to me, or indeed my own sense of whether I deserve any of those opportunities. However, I'm optimistic. Things have changed over the years. Things have got better. There's a long way to go, but we can see we can make those changes. I am particularly privileged. I've had a lifetime of a very positive family background and a great education. I've had the support of my colleagues and great mentorship from my leaders. So for me, it's not a question about whether I should support others to achieve the sort of positions that I've achieved. It's how best to do it.
So good afternoon, I'm Marcia Jackson, Institute Manager for Women's Health and also co-chair of the Race Equality Steering Group. I've been at UCL for over 20 years now, and I would like to see change in the BME, increase in BME senior staff. I think that's really important because the junior staff are clustered in the lower grades, and it would inspire them to actually reach their potential if they see more, if it does become a norm. And also for students, I believe there's over 40% BME students at UCL, and they need a diverse group of people who teaches them. I have a grandson who is 10, and I remember when he was 6, so that's 4 years ago, he said to me, "Mum, why isn't there any black people on the TV?" He was referring to whenever he sees the adverts. Now, in 2018, I'm pleased to say that's no longer a conversation in our household. So things are improving. As the Provost mentioned, I met with all the deans last year with Ijeoma, and we're meeting with the UCL, the leadership teams this year. And so I've had a look at the data recently, and we found that there's been an increase in academic staff, BME academic staff, from 11% to 12%, and that meant a total of 27 new BME academic staff. And when you look at grades 7 and 8, it's increased by 2%, from 17% to 19% from last year to this 2018, and that's over 134 new BME academic staff. So I think that's really something to celebrate. Unfortunately, it's not the same for professional services staff. In the grades 9 and 10, that's been decreased by 1% from 9 to 8. But it's remained static for grades 7 and 8 at about 21%. And I must say that within our faculty, we do exceed the UCL average.
Thank you very much. I'm Max Palmer. I'm a professor of Medical Statistics and Epidemiology, that's it. And I'm director of the MRC Clinical Trials Unit at the Institute of Clinical Trials and Methodology. This is always a challenge because we're now talking in the I rather than the we. We academics talking we, not rather than I, don't we? But just to give you a little bit of I'm a second generation immigrant who grew up in the 60s and 70s in the UK. And if people remember back that far, the minority and ethnic groups, it was quite a challenge growing up at those times. Over the years, what you can see is that my experience is that things have improved somewhat steadily. And you felt that things were getting better. And although not ideal, you felt that things were getting better. My own sense is the context has changed again now, especially with the populism, the hostile environment and the like. The language, the approach, and just general society and the context in which we're working has changed quite markedly. And I think we need to recognise that in UCL. We need to call it out, both within whatever happens within UCL, but also the wider environment. I think what has been hugely positive has been the Athena Swan process across the university and across a lot of the institutes has shown that actually that real change can be made, and the recognition of diversity and inclusion of really talented individuals and what they bring differently to the whole organisation, women in this regard, has been a huge positive for many institutes and the organisation as a whole. And that positive step that that Athena Swan has made us make is a really, really good thing. There are many underrepresented groups. Of course, women are one of them, but black and ethnic minorities another. I think we need to apply similar thinking to this area and recognise that the first job is to call it out, and today I think is the calling it out phase. But then we've got to decide what we can do about it, and part of that is to understand some of these issues and why black and minority ethnic people aren't putting themselves forward for promotion, or why these things aren't happening as much as looking at the figures. We need to get some qualitative data on why these things are not happening, which is really quite a challenge.
Thank you all so much, and thank you for your honest openings. That's fantastic. What we'll do, we're going to take about 10 minutes of initial Q&A, if that's okay, and then we'll break into some smaller group discussions as well. So does anyone have any initial questions for our panellists?
Maybe if the panel could describe an instance that has really hindered their progression and then how they've kind of overcome that.
Is that okay? Would anyone like to kick off? So how one of the panellists has experienced something and how they've overcome it? Yeah. people got anything that springs to mind? Or is anyone in the audience?
The reason for the question is that I think one of the biggest issues is lack of role models for people. And also, in my own experience in the last couple of years, I've been appalled at how many people haven't been appraised for several years. So I think that's one of the key issues, is we all can get the appraisal system where some of these issues are discussed. I think we're going to really improve changing the culture, which is obviously going to take a while.
Okay, thank you. So I guess we can pick up on appraisal. Has any of the panel got any thoughts on appraisal? The consistency of it, the quantity of appraisals taking place and the quality of them?
Well, we introduced annual appraisal. It's all right, I can speak. Can everyone hear me? All right, okay. We introduced annual appraisal in the faculty before it was rolled out across UCL, so we've certainly been determined for academic staff that there's annual appraisal, and for professional services too. So that's missed some parts of the faculty previously, Lucy, is a significant concern. But I think that not everybody experiences appraisal positively. And where that is not done in a way that facilitates the personal development of individuals, or pays particular attention to, attributes that they have, whether that's, BME in relation to sexuality, in relation to gender, or disability, or whatever, is something that needs to be addressed. So I think that, my concern is, it's the culture in which people don't put themselves forward rather than their individual volition. So my concern is that there are structures that are preventing that occurring because of cultural dimensions of the organisation, which may be completely unconscious for those individuals involved, but has the cumulative effect of resulting in some senses, holding sections of our community back. And I think that's what we're here to address.
Absolutely, and that's come out quite strongly from the survey as well. Yes, we've got a question in the middle there.
My name's Asma Ashraf and I work at the Institute for Global Health. So there were, in the audio that you shared, and I think it's a follow-on from your question there, but how do we want to call this out and talk about it, but how do people recognise the subtle, covert racism that might be there, or unconscious bias? I mean, a colleague and I were having a conversation before we came to this meeting, but I've heard colleagues say, oh, well, people might be racist towards me after I've done the bullying and harassment training, and I recognise there might be, but if you don't know you're doing it yourself, or that other people might not realise, well, how do we address that? How do we talk about that? What's the plan? Are there any recommendations from the panel, wider EDI?
Well, I can kick off from wider EDI. I know we have had unconscious bias training. I was expecting a big groan there, but not yet. It's something that we are aware of and that we are trying to address, and we're trying to feed into all the different programmes that we've got, and we're trying to remind people about regularly. I don't know if the panel want to pick up about what's happening within the faculty specifically.
Well, I know that we're running the harassment and bullying workshops. So we've had a series of those, and what we're trying to do is actually get 100% of our staff through them. And I think we've got about 2/3 of the way now. So we'll continue to run those. I know the sessions are being put on by EDI across the faculties.
For our department, we were told that about 60%, bullying and harassment is compulsory for people to attend, and only about 60-something% attended. So not everyone attends, and we're looking at organising further training around race within our department. But how do we get people to come in?
Yeah, that's a big issue.
Okay, Max?
So, I think this is partly an issue for leadership, and partly an issue for ensuring that transparent and regular information is fed back to both the leaders and also the staff within the organisation about how well are we doing in this area, what are the issues, and so regular discussion of that in the same way we've done for Athena Swan automatically brings this to the fore and allows people to ask questions around it. What we don't have is a framework for doing that at the moment. And just putting it on the agenda formally and making the leaders responsible for reporting that back to their institutes and then discussing it with their institutes will be a big step forward, I think.
I have to say it was very uncomfortable listening to the comments and the transcripts there, and it does, it leads you to both look into yourself, to think whether you're contributing to this, but also in leadership roles, what one can do about it. I have to say, despite having invited everyone really in the Institute and encouraged people to come and talked about the importance of it, I'm disappointed not to see more white faces around here to be listening to these really quite shocking stories. And so I think we do need to do more to make people aware of how their colleagues often feel.
Have you got any ideas for that?
Well, I don't know. I think the where do you draw the line stuff has been very useful, and systematically going around and more and more bringing people in to discuss those issues. We've had very good feedback from those. It's still tough to get everybody to come, but we're getting there. I think a similar process here would be good. Athena Swan, I think, is excellent. I think a lot of the way that Athena Swan's worked is by trying to make things fairer for everybody. So I'm hoping that that's had some knock-on effects. A lot of the interventions that you do in Athena Swan are, things like making sure everybody has appraisals, everybody knows the promotion criteria, that they've applied criteria, fairly, that sort of thing. So, I think there's a lot of these organisational things that can help. Changing the culture, it's a slow thing.
Okay. Do you mind passing the microphone to the gentleman in front of you? Thank you.
Hi, Ibrahim Abubakar, Director of the Institute for Global Health. So I think the statement that Graham did not have on a slide about why is it, how can you convince us that this isn't tokenistic, for me is actually the most pertinent one. I would say over the last few decades in my career, purposely avoided loads of equality and diversity issues for the very reason that I believe they are tokenistic, that they are designed to meet the legal obligations of institutions to say they meet certain requirements that they are put forward to do. I think Athena Swan, of all the initiatives, provides an example where it can be done successfully. It's complicated by the fact that in this area, there isn't actually the same metric. Half of the population are women, and therefore there is a metric to work towards. Using London's population as a metric to compare UCL is probably not appropriate. But Athena Swan didn't work by wishful thinking or by doing unconscious bias training. And I'd like to see evidence that actually that's had any impact at all. Athena Swan works by essentially a punitive mechanism where, for example, medical schools can't have a BRC if they don't have a silver award. There is a reason to incentivize the deans of medical schools that are largely white male to act in a different way from the way they've always acted. And I've been around in the system long enough to have seen that change, and it's been amazing. If we're serious about this, we need to have something concrete that goes beyond asking the people who are the receiving end of this to just say more and do more.
Okay.
There's something I want to say that which I think is an important background factor, and I was going to answer this in response to Lucy, although it wasn't actually the answer to Lucy's question, but I thought I'd use Lucy's question as a springboard to say it. So for me, a very important personal moment was when we held the event called Why Isn't My Professor Black? And for the first time ever in my life, I was exposed to what BME individuals are exposed to in reverse, which was me as the only white person on the panel, and a room that was predominantly full of BME staff from our university, but also from other universities all around the country. And what happened in that meeting was really quite an extraordinary outpouring of stories of essentially institutional racism. Now, for a university leader to get up and use the words institutional racism to describe your own institution is a really, really important moment. And I now feel comfortable using it and saying it, but I can tell you that a lot of university leaders find that very difficult because, you know, that inherent self-criticism is really tricky. You know, I think there's a real background to this that is a realisation that, you know, I've been able to spread from that meeting, started with that meeting, across to all of the deans. We've done a number of really concrete things. I mean, I am very proud of the fact that we have decided to lift equality, diversity and inclusion, the team, out of HR and into my office. Hopefully sends a very, very loud signal about how serious we are about trying to tackle this set of issues. And then for me, this, you know, we can go on talking about it and measuring things forever. What we've got to do is do some things differently. And I can mainly talk about what I've done in gender because there's been more that I can speak about, but I am trying to spread that over across into doing things differently for race. So my personal example is the way in which I handle long listing and short listing and our interaction with recruitment agencies to ensure that our long lists are more balanced. And we've been doing that for quite some while for gender, and we're now doing it much more for race. So all of our recruitment teams at the highest level for deans, directors, vice provosts, chairs of council, etc., are done in a way where our headhunting teams, our executive search teams, I guess is the more polite term, are asked to make sure that we're presented with candidates from BME backgrounds as well as females, and obviously some intersectionality as well. So a real live example, I don't think I'm giving any secrets away here, is that we shortlisted we didn't shortlist at all. We longlisted for the director of HR to replace Fiona Ryland because Fiona got promoted to be Chief Operations Officer. And I can tell you now that long list has 9 people on it. 6 of them are women, 3 of them are from BME backgrounds, and 3 are white. So, 3 are men. So, you know, that's a worked example of constructing a long list to give people a chance to come through and shine and get promotion. And then if you look at the track record of what's happened at the senior level in this institution, when I first looked at UCL and thought about becoming your president and provost, there was 1 woman on the senior team, full stop, out of 17. I have personally appointed now 15 women at senior level and 8 men in the various appointments that I control and chair. So there are actual examples of doing things completely differently that have made a difference. The next thing is, you know, the touch on the shoulder down the pub. And Ibrahim is absolutely right. This happened to me at a different university. Michael, we need to take you down the pub because we think you should become the next head of the School of Medicine. And it's very flattering, and so you go along with it without realising that it's totally, you know, not the way to do these things. And we took a lot of resistance to this internally because there is a strong desire to have a nominations process and a voting process to select the next head of department. And it was fine, except, of course, it wasn't working for gender or race at all. So white men were largely tapping white men on the shoulder, and white men were largely voting in favour of white men leading them. And we've cut right across that by saying we're not going to do it that way anymore. We're going to have a proper appointments process. We're going to convene some panels. We're going to put some panels together that can recognise all of these different issues, and we're going to start doing things differently. And immediately, the number of women who've been appointed head of department has doubled. So it can be done by some fairly simple things that are just very obvious, that start to send the signal that we're dead serious about this. Are we doing it because, you know, it's a nice thing to do? No, we're doing it, you know, I'm quite commercial about this. I want the very best people in the very best jobs, and I want the diversity of the human race reflected in the leadership of this global university.
Thank you. And I guess now's the time for us to start thinking about intersectionality as well. You probably saw the research this month from Nicola Rollock that there's 25 black female professors in the whole of the UK higher education system.
And in the first part of my career, I mean, I was at an institute where I felt invisible because I was not being supported. A lot of it was to do with the local politics within the institute rather than a UCL-wide effect. And it was, I went through about 16 years with being overlooked for promotion or even being supported and having appraisals. And it took me having to go to a more senior person at, above the institute level to actually get the support that I've received. And it has fundamentally changed my position here at UCL, my attitude towards my work, my success rate, etc. And it's made a huge impact. And yet for 16 years, this was not available to me. And I just wasn't sure whether it's me as a woman, whether it's me as part of a sort of group that had problems, or whether it's BME. I wasn't sure. And it comes back to the point about subtle issues. How do you deal with them? And if people are in a similar situation, what are the things? I mean, I think with the Athena Swan and the other initiatives that have been available at UCL, it probably is now a bit more easy to approach this, I would hope, and that then students or staff who encounter that can actually get the appropriate support or actually be picked up at an early enough stage to not encounter that sort of problem.
Do any of the panel want to respond to that? Or should we pick up a couple more questions? Yeah. Thank you very much for that. Thank you. I'm very aware that I think I've been favouring this side of the room. Let's, because I'm standing here. Can we go to lady at the back and then we'll come down to Sarah? Thank you.
Now, it's not really a question, but maybe a comment that I have. The language that we're using is almost divisive in a way. We say white and ethnic minorities. There's a division straight away. And race can be quite personal and very diverse. Going back to the statistics that we saw at the beginning, why people may not be answering. For a long time, I never answered because I'm mixed and they never had a box for me. Or I had to tick about 3-4 boxes to actually truly describe what I believed I was. And just the other day, my friend who is Latina didn't have a box for herself. She doesn't consider herself white, she doesn't consider herself black. What does she tick? And so oftentimes I wouldn't tick. So that may be something you can look at. Yeah. But the idea that, you know, you've got the white and the other, which is everybody else, is almost separating. And if you have an issue with the other, that language is quite negative. And so now, I have to deal with the other. Do you understand what I mean? So I think we have to consider how we're presenting this kind of initiative so that people don't start dividing themselves along race lines, because the whole point is to unify ourselves, isn't it? And so we have to understand that race is actually nonsense. The bottom line is it really never describes anybody. It's just the way that we use to categorize things to make things easier for ourselves. We've been doing it for centuries and it's a load of nonsense as far as I'm concerned. However, we need to use it as a tool today. So we have to figure out a more modern and inclusive way of using this tool.
Well, I think we're torn between wanting to get better data that's of higher quality and the kind of structures that we use to do that. I think what you've described in terms of other as a category, for example, is an example of institutional racism. I think the limitation on people's self-identity in terms of that range speaks to our inability to capture that properly. But we really do need to capture it because we see the structural consequences in racialized terms, however you want to understand that. And this has real consequences. And so we need that information to better deal with it. So I absolutely agree with your point about self-identity. But I think we need to improve that so that the data are there that can show, and if at the very least as baseline, so that we can see some sort of progress. But I absolutely understand and agree with the concept of the challenge that racialized identities, and particularly when they're imposed by others, has for individuals, what the consequences are for individuals. So I think it's a very, very challenging area, but I'd rather have more information than less, and to be at a point when actually we don't need to ask the question because it's not an issue anymore. But until that time, we need that better information. I was just coming back to Michael's experience of why is my professor not black. It was an amazing occasion and a turnaround moment for me too. But I was particularly struck by one black woman who also said, actually coming from a working class background in a university was also, quite challenging to understand some of the other cultural dimensions. So I think this again speaks to the racialized issue. It's not just that, there are other dimensions which might be around gender, which might be around class. There are other dimensions there as well in terms of people's identity and how they experience being here at UCL.
Thank you. We're going to take one more question here from Sarah.
Yeah, my question actually follows on really well from that, in that I wanted to ask whether the complexity of BME, whether there were different problems, different challenges for different groups.
Yeah, does anyone on the panel want to pick up on that?
You're right, and I think it follows on from the discussion we've just been having, that putting people into one BME box doesn't really address the issues. If you look at cardiovascular medicine, for example, well represented by South Asian folk. There's perhaps even overrepresented. No people of African origin at all in that. So it's not one size fits all. To add something else into the mix, we don't talk about Eastern European folk, but there's discrimination there as well, and there's quite a large population. And oftentimes I've been asked to sit on panels to represent the BME community, as if I can speak for everyone in this room practically, and all their experiences and that diversity. And it also means that all the white folk don't need to deal with it because there's one person sitting there who deals with it all. So I think there's a whole range of issues about that diversity that we're not even beginning to address.
Thank you. Yeah, we've seen it in the data as well. The degree awarding rates are starkly different by ethnic group, with black students getting the fewest amount of firsts and 2-1s, which has a huge impact on the pipeline going forward. Yeah.
Yeah, so I would agree with the complexity issue. I think, though, we shouldn't let that prevent us from recognising the larger issue here, the representation and the diversity at various levels, particularly senior levels within the university and more broadly. And with all difficult, complex problems, you have to start somewhere. And that's where we need to start, is recognising that problem, calling it out, and making some, I'm pleased to hear some of the structural changes. There are more probably structural changes we can make, and then dealing with the complexity. Because there's a danger that it's regarded as too complex an issue, and so we just put it away. And that and that we have to understand all the different nuances and the complexities for every individual, which of course are there. And we don't deal with these bigger issues. And so we do need to make a start here, and we need to do some positive things to start with, and then we can move on to the next level and the next level.
Thank you. I'm gonna end this session there, and we're gonna move on to just a smaller group discussion, if that's okay. We keep saying that this isn't tokenistic, this isn't a one-off event, this is going to lead to more change, but we need to think about what we're going to do next. I know it's not ideal because we're in a lecture theatre, but do you mind trying to turn to the people? I'm going to start with a question that was actually submitted in advance. So we did offer the opportunity to send in questions in advance. So I'm going to ask the panel, these are slightly related. So one person said, why can't we have work shadowing specifically for minority ethnic staff so that more junior members of staff are able to shadow more senior members of staff? Is that possible, do you think? And then someone was slightly more bold. If we leave the legal position of it out of it for a second, hypothetically, could we ring-fence promotions opportunities for minority ethnic staff for grade 8 and above, where we know that there's a significant underrepresentation?
Shall I deal with shadowing?
Do you want to do that?
So there is a shadowing scheme already, through the Future Leaders programme, and people can choose to take that up if they wish. And so I had a BME professorial colleague from an institute in the faculty who shadowed me for I think she could only take 3 days actually. It was quite enough after that. But anyway, she got a very different perspective on leadership at this level. So that was very positive. I'm wholly supportive of this, and I think that we could cascade that through the organisation, because I think if you're a grade 7 professional services person, you need to see what a director of operations actually does, and you need to spend some time with them. So I think that introducing that would be a really positive move. So fully supportive. I'll turn to Michael, but we've just been discussing this exact point about ring fencing posts.
So I think I would say 2 things. First of all, there is a legal position and you can't ignore it, and we can't run practices that are open to accusations of discrimination and inequality within the law. So that there's a real practical issue there. But there's a second point, which I think is probably the more important one, which is I can honestly say that all of the people that I've promoted since I've been here have been the best people to get the job in their own right, irrespective of gender, race, etc. And that's been really important, because they come into a peer group where everyone knows that they were the best person, selected from an international field or whatever. And what you don't want is people feeling that they got the job because of a characteristic. Generally speaking, women do not want to be promoted for the sake of it. They want to be promoted because they're good enough to contribute. And I worry about that. If we get off on the wrong foot, doing something very different about race, then I think it could easily backfire and not be what people are really asking for, which is to be treated as equals and given equal opportunity to excel.
I would support much of that. I think, though, having said that, we do need to recognise there still is a problem, and that we need to take positive action to address that problem. It may not go to the extent that Michael was talking about in terms of positive discrimination, but we need to take steps to have positive action in this area to support and help people to achieve what is not being achieved in getting that diversity. It's not the same thing as positive discrimination, and I don't think we should combine the two.
So I'm going to agree with that, and just to say that there are all sorts of positive actions that can make a difference. Number one of which I think is bringing more people to the starting point of the opportunity who have characteristics that we're looking for, whether that's gender, race, whatever. Of course, you don't necessarily always have the right information at the starting point, but that works. If you bring more good people to an opportunity, then the chances are that they'll come through the system and get the job. And so I think that is something, I can control the long list for senior posts. Deans can control the type of applicants they can cajole to come forward to be considered to be a head of department. So working at that front end, I think, is a point at which you can have positive actions.
Thank you. Right, let's hear from all the discussions that you had. Has anyone got any really good ideas or any further questions that they want to raise?
It's kind of to pick up on the point that was made earlier about subtle racism that you might not pick up and people feeling as though they're being held back. I'm just wondering if there's anything that could be done at a higher level, maybe having panels in place for recruitment so that individuals know whether or not they're being advised that they might not be ready for a position because they actually aren't ready, versus just the opinion of one line manager who might not think that person's ready. So, for example, if when promotions became available, if there was a panel that identified individuals and said, well, this group of people have been doing X, Y, and Z for this many years, maybe they should be encouraged to apply for the position.
Yeah, does anyone want to come in on that? It came out in the survey as well. There was a survey respondent who said that their direct line manager told them not to apply for promotion. They applied anyway and they were successful. So yeah, that's a good point.
What I'd like to ask is, on the recruitment side, how do you go about, what's the sort of things that you look for? Because in my opinion, when I went for a position, I felt that there was already a picture of exactly who they wanted for that particular role. And as a black woman of a certain age, and also not coming from a financial background, I felt I was extremely discriminated, because straight away I never got the job. I was told I was too financy because I came from a financial background and I was looking for an administrative job. But really and truthfully, a lot of the stuff you do in finance makes you can apply that skills anywhere, into any job, apart from something scientific.
If I can respond centrally, I know that our organisational development colleagues are looking really heavily at thinking about transferable skills so that professional service staff are more able to move up.
I felt that being a woman over 50 discriminated me, because as far as I could see, it's, well, we want somebody within a certain bracket, a certain picture, a certain look, and I didn't fit that look, and I think you need to address that.
Yeah, and the fair recruitment specialists as well, we're hoping to have some impact with. But yeah, it is an issue. Does the panel want to come in on that at all?
I think it's the idea that a panel has in its mind what the person looks like, which is quite an interesting concept. And it's this unconscious bias, it's embedded. And I think that this is where it's really good to be challenged by a BME colleague on a panel or a fair recruitment specialist who says, actually think through some of these things, and particularly when you're presented with the people coming into the room. So I think it's really a positive thing. One of my challenges is understanding better and having some sense of how to deal with the issue of microaggression, which people have mentioned and came up in the quotes. And that is extremely challenging at a institutional level to deal with, absent major cultural change. So it may be that it's absolutely related to that, but it's something that seems much less able to be grabbed hold of at an institutional level, the nature of those microaggressions. And so that's, I think, where I'm really challenged in a leadership position, is how to prevent that, and Matt's used the term call it out, how one does that when it's, in most cases, to a senior white male, totally invisible. So that's my real challenge in this.
Did anyone have any thoughts or ideas on them? I will come to your question, I promise. On microaggressions, how do you tackle microaggressions? I think that's the work in progress, isn't it? One other point, coming back to your interview situation, is I think as a university, and we as the EDI team need to be better at looking at intersectionality. So the biggest criticism of Athena Swan is that it's benefited white women with a PhD. We need to think more broadly, and we need to think more in a much more complex way about things. So thank you for raising the point. Yes, lady in the middle.
Hi, I think what came out of the discussion in our little group here are actually two things. One of them was role models at every level, so that actually you have a champions who you look up to, and then they can guide you. But the second thing, and maybe this is sort of a novel concept, when we think of UCL, we actually don't see the representation that we see in this room at senior levels. There's not a single picture of seeing how diverse even, from the top down to institute directors and so forth. I don't think anybody can see that and make them inspire to really go for certain positions and so forth, and just to say, well, I may be that person one day. I don't know whether that is a simple concept, but I don't think anybody can visualize. We can see the UCL picture of the sort of the building, the central building, but we can't see the people behind that building for some reason.
I think it's a higher education issue as well. Well, it's a societal issue. There are two, as far as I know, two black female vice-chancellors across UK higher education, and neither of them worked their way up through higher education. They came from outside, from different sectors in. So yeah, it's a really, really valid point. Did the panel want to come in on that? Are there any other thoughts or questions? Yes, two over here. And after that, has anyone else got any? And one more here. So if we take these two and the lady here, and then I think we might have to call it a day.
Okay, we've got lots of post-its, so I'm going to read 4 out. The first was to force, to incentivise, or to punitive, whatever. You have to force the action. The other was, we heard a really good example last week of the medical school changing some discrimination on a you say, you do, on a we feel, we think basis, and that really brings home the effects. The third is, for example, looking at the black students doing less well. I know within my department there's people with really good ideas on how to look at that and whatever, but they need some money to really research it, so perhaps to offer some money for projects and research. And then the fourth one is a little bit of a joke, but what if we all did sort of some DNA profiling, and then we all found we were all a complete mix, and then, we haven't got this white and other, we're all a mix completely. So UCL could offer some DNA profiling for free.
Next up, the eugenics review. Whole genome.
Thank you. Yes.
So I think the best example that I can think of that we've seen this week in dealing with microaggression was Joe Root, in the context of homophobia, calling it out in a very calm, measured way, caught on camera. The insult wasn't caught on camera, and I think every time somebody makes a racist comment or a comment that is unacceptable, you say, I'm sorry, I think you need to retract that. I think you need to think again before you say those sorts of things.
Yeah, is that the cricket example? There was a homophobic comment made in the cricket, and Joe Root replied, it's not okay to use
There's
being gay as an insult.
Being gay.
Yeah, thank you. It's a good example. And yes, our final question here.
Just talking about having more clarity on what the selection criteria is, say, for example, in jobs, and also specifically for programs that we run at UCL. There was a UCL Women in Leadership program that ran last year in July, and there were candidates that applied for it, but we had no idea what the selection criteria was. And then for some of them that did apply, they received no feedback either at local level or central level. And so, in my perspective, I wouldn't apply again at all, because why should I when you've given no feedback or no updates on the program itself? So I'd say more clarity. And then when we do, put programs forward like this, we need to highlight, how well they do and how well they get on as well.
Yeah, absolutely. We need increased transparency all the way through. Does the panel want to pick up on, or actually, do the panel want to make any final comments before we draw this to a close? You don't have to.
I'll make a quick comment. I think the diversity issue is a big issue, and we've touched on social class, but I think that is actually quite an important feeder into some of the discussions that we've had, and it's the sort of hidden adversity that people don't address.
So I'd like to say I've been involved in race equality for quite a while, and this is the first time, the last couple of years, that we're actually doing something, we're actually addressing the issue. So just to say, we've come a long way. I know we've got a long way to go, but I think we're in a really good position at the moment.
I would just say that I see this as calling it out, and that we need to take some positive action in the same way how we have in other areas to ensure that we make some progress?
I think the leadership should be tasked with addressing this. Michael's shown huge leadership in this area, and I think we're showing sector-wide leadership. There's a huge way to go, but I think I can speak for certainly colleague deans in that we're really determined to make a difference here. And I think what we're wanting to start here is that conversation, but as I said earlier, it's a conversation that has to lead to action. Otherwise, we will be doing that thing that I read out from a BME female colleague. This would be tokenism, and frankly, we're not in the business to simply sit on panels. We're here to effect change, and that's what I'd like to see.
Just to finish, I'd like to support what Ros said. I think if we do see microaggressions, let's call them out. I think the Joe Root example is a really good one. And ultimately, of course, we want less microaggression through culture change. And if we stick at this long enough and hard enough, that cultural change will eventually come in, and that will be very pleasing. And then just to comment about the leadership training and the point about feedback, I mean, I think that's just a great example. There we are. We think we've done a good job. We've put together some proper and high quality training for those individuals that got on it, and we haven't thought enough about the individuals that didn't get on it. So I have a slightly different take on it, which is I'm happy to train anyone in leadership, and the only question is when you get on the programme. So I'd like to see us saying, well, you know, if we've got a massive number of people coming forward that want this and we're not able to provide it, why don't we increase the amount of training? And of course we can try and give better information back to candidates. You know, for example, sorry, we're oversubscribed, we really liked your application, please come back in next time, or even better, we've already put your list on a waiting list for next time. So it's not a no, it's a yes, when type approach. So we'll take that specific point away, because that is something that we can control.
Thank you. My big takeaway is the microaggressions. We need to do more. We need to think it through and think about how we tackle that holistically across the university. We have run out of time. This is a starting point, not a finish point. So we will be following up. We'll be typing up all of the points coming from the discussions. We want to get as much from your written feedback as well. So please do use the post-it notes and the flip chart paper. Keep writing if you've got more thoughts and ideas. And we'll be sending that out afterwards. I would really like to thank all of you very, very much for coming and sharing really honestly and candidly. I think it's really important. And also our panellists. And can we give them a little round of applause? And then just lastly, lunch is going to be here in a minute. We'll finish with lunch. I just want to completely embarrass Kate Fernandez, because without her, this event wouldn't have happened. And she's done all the behind-the-scenes work on it. So can we thank Kate as well? Thank you.